This is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeokogy.
Preeclampsia is a medical term for severe pregnancy high blood pressure, and you're probably wondering, what causes it? Here's a hint: the baby. Learn more about other risk factors and what does preeclampsia mean for you and the health of your baby. All coming up on today's Pregnancy Pukeology Podcast, episode 70, What Causes Preeclampsia? Do you want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, or headaches now, and get 25% off with the code PUKE25, that's PUKE25, or just place your pneumonausea band on your registry for your delivery room bag at Bye Bye Baby, or get it shipped for free in just 2 days on Amazon as a Prime vendor, where you can also find ones for your kids. No More Nausea Kids and No More Sleepless Nights Kids. The sleep one works on moms with small wrists too. Now available at your local Walmart store and CVS.com too. Pregnancy humor you're going to hear that may just make you want to pee your pants. Like you don't have to pee all the time anyway, with hilarious stories like Double P, Chunks and Vents, and Taco Tuesday coming up. If you want to learn more about your pregnancy, humor and knowledge is key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind the definition of preeclampsia, how far along in your pregnancy can you still be at risk, what does it mean for you if you have been diagnosed, and natural remedies that are backed by science, of course, only the real deal medical stuff from this doctor. But we're going to talk about what and how we're going to put pressure on high blood pressure in pregnancy. All coming up right now with everything you need to know about preeclampsia, episode 70.
The science of puke, Pukeology.
So pregnancy comes with a lot of physical, social, and psychological challenges. You guys are probably already figuring this out, ladies. It's perfectly normal if you experience symptoms that like morning sickness, loss of appetite, mood swings, gain of appetite, vomiting while pregnant, all of those wonderful entities. However, there are symptoms in signs that you're having when you're pregnant that need further investigation and treatment. One of those signs is high blood pressure, leading to a condition known as preeclampsia. So high blood pressure, also referred to as pregnancy hypertension, is defined as having a systolic blood pressure above 140. Or a diastolic blood pressure above 90, where diastolic is actually more dangerous. And I'm going to explain why. So what's called systole versus diastole. So systole is that lub-dub, right? And then it's a relaxation period of time. Well, the rest of the body, when you have a systolic pressure, pushes. So think of systolic, like really pushing that blood through, gets to the rest of your body. Diastole is that relaxation period. But guess how blood flows through to the heart? It's during diastole, or the relaxation period of time. But if the pressure is too high, guess what? There's no relaxation. So if there's no relaxation, it can put more stress and strain on the actual heart. And that's the reason why we take a look at both numbers, systolic, which is the top number, and the diastolic, which is the bottom number. Studies have shown that 1 out of 10 pregnant women develop hypertension during pregnancy. Whoa, and that's not even considering some pregnant women may have a primary condition of hypertension. And usually young female women during childbirthing years don't have what's called hypertension or high blood pressure, but there are some, and those are called familial hypertension, meaning it is something genetically that you and your family might already be predisposed. So what is preeclampsia? Preeclampsia is a pregnancy-induced hypertension that develops after 20 weeks of gestation in a woman who has previously had a normal blood pressure, meaning you did not have blood pressure issues before you got pregnant. Usually, a pregnant woman with preeclampsia tends to lose excess protein in the urine, and this is that proteinuria. You will also see proteinuria and actually ketonuria when your body starts eating away at muscle if you have severe morning sickness. So if it's really bad, you're just vomiting all the time, that actually is what we call hyperemesis gravidarum. Some of these women, it's HD is like the acronym for it, but some of these poor women are literally in the hospital hooked up to IVs because they can't keep anything down. And so we monitor both protein in your urine and ketones in your urine because of the fact that we want to see when your body is malfunctioning. So again, like we talked about with pneumonausea, which is the wristband that's actually utilized during labor and delivery, you can actually use that, and they have been using that in women with severe pregnancy morning sickness or hyperemesis gravidarum, and it's proving how well it works utilizing acupressure and essential oils that's combined into the wristband, and it actually shows that it decreases the amount of ketonuria, which shows it decreases the amount of muscle wasting and it helps to hold food down. So again, if you're more curious about that, go check it out, pneumonausea.com, and or just go on to Amazon. All your answers can be found there as well. Going back to women with gestational hypertension, or also known as pregnancy high blood pressure, they do not tend to lose a lot of excess protein in the urine. When a woman with preeclampsia experiences a seizure, the condition is now termed eclampsia. So pre-eclampsia, before a seizure, okay, if you want to think of it that way. But eclampsia is a full-blown seizure. As a physician, I have had the unfortunate event of watching preeclampsia on a woman who was about to deliver. She was almost 40 weeks gestation, and she ended up having a horrible seizure, decreased the amount of oxygen that she got to the brain and the baby passed away. So she had a stillbirth following her seizure in the car when she woke up. So again, this is not something to be taken lightly, meaning her blood pressure was so high. Make sure that you're being seen, ladies. Always make sure that you have an OBGYN, a nurse, a nurse practitioner, somebody that is taking a look at you and watching you throughout your entire pregnancy. It is crucial. You just never know when something can go awry. So again, preeclampsia, we've got some good news, ladies. It resolves. Guess when? Immediately after giving birth. Yes, that's right. So the baby is actually the culprit and the cause of women with high blood pressure during pregnancy. It is the baby. It is the hormones that they are creating, and it is the baby itself. So the only clinical way to treat preeclampsia is to take the baby out. So that's what happens. A lot of times these women with preeclampsia will start developing a lot of flank pain. And what that actually is it's the spleen. Okay, so what's happening is the outer casing of the spleen is stretching so much that it causes this severe headaches and flank pain. And that's when we as a physician say, all right, it's time. Mother cannot survive any longer. Let's take this baby out before the mom goes into full-blown seizures and could potentially put the baby and the mother's health at risk. All right, on the other hand, women may develop high blood pressure with excessive wasting of proteins in the urine after having the baby. Now, this is referred to as postpartum preeclampsia. So again, preeclampsia during the actual pregnancy, different than postpartum pre-eclampsia. So again, there are two different methods and modalities. If it's the baby that's causing it and or other external situations that can also be causing it. One of the main ones is after delivery, we always make sure that we check for any type of remains, like placental remains and things like that, that could be a signifying your body sending a signal saying, hey, there's something wrong. Usually that is excess bleeding is how we know. So what causes preeclampsia? Preeclampsia affects many parts of the organs. It affects the kidneys, the heart, and the unborn baby as well. Unfortunately, the exact cause of the condition is yet to be discovered. So like we said, it's the baby of you being pregnant, but we don't know the actual culprit. However, there are some known risk factors that do increase the chances of you getting preeclampsia. These ones include getting pregnant early in your reproductive years, so younger than 20. So all those, 16 and pregnant from MTV, they're actually at an increased risk. Or if you get pregnant really late, when your fertility starts diminishing, and that's what we call advanced maternal age. I know, ladies, that sticker on the chart is just heartbreaking to us women who are over 35, but I will tell you that it is, when we look at the life cycle of your fertility starts to decrease and you have an increased risk of complications such as chromosomal abnormalities in the baby, trisomy, different things like that. Down syndrome are also elevated. So the perfect time to have a baby between 20 and 35 years old. Another one risk factor is having a family member who's actually had preeclampsia. So talk to your mom, talk to your sister, talk to the people that are in your immediate bloodline and just ask them if they had preeclampsia or pregnancy, high blood pressure. Having chronic hypertension, this is high blood pressure before conceiving. So if you're on, let's say, lisinopril, or you're on a blood pressure medication before you get pregnant, chances are you can have an increased risk for having preeclampsia because you're already at high blood pressure state. And so imagine your body just kind of goes ape crazy and it really skyrockets up from there. Another complication or a potential risk factor, having long-standing kidney disease, diabetes, and getting pregnant with more than one child. And I'm going to put that as like a little asterisk. It's not saying that when you're carrying multiples, you are definitely going to have high blood pressure. It's just saying that the chances are increased for developing preeclampsia if you have multiples. Other risk factors can also contribute to the development of preeclampsia, such as not having blood pressure checks regularly during your pregnancy, failing to attend your prenatal visits. Okay. We schedule them intentionally so that you can come in and talk to us about what you're feeling. If you're having excessive headaches, these might be your body's way of saying, yep, definitely it's your blood pressure. And again, I'm going to put an asterisk on this one, low socioeconomic status. And please, I'm not trying to be offensive to anyone, but what we have noticed is that low socioeconomic status, or those who live in very rural areas, don't get the medical treatment that they need because the access, right? Getting to the appointments might be a problem if you don't have a car, living out in the middle of nowhere. But again, please make sure that you make you and the baby a priority during your pregnancy. Preeclampsia symptoms. So what does it really look and feel like? The symptoms of preeclampsia resemble those of chronic hypertension or high blood pressure. They increase in headaches, visual disturbances, and abdominal pain. A woman may also experience symptoms to those that are kind of like early in pregnancy, but they just don't stop, okay? And that is nausea and vomiting, okay? You need to make sure that you always look into and seek medical attention when experiencing these symptoms over a prolonged period of time, okay? It is known that 80% of women will have morning sickness. You don't have to suffer because no more nausea ban was created, which is awesome. You throw on a ban, it's natural, you smell it, instantly you stop vomiting and getting sick, and then again, you kind of get to go back to the rest of your day. But when it's a long-standing history of nausea, vomiting, really bad headaches and migraines, visual disturbances, you need to go see someone. You need to make sure that you talk to a medical professional, a physician, or a midwife, a doula, whoever it is that's taking care of you, to talk to them. In addition, women with preeclampsia may be gaining weight faster than normal. Preeclampsia can also cause swelling in various body parts like hands, face, legs, especially when it comes to legs. And I always say this, ladies, nobody likes cankles, but it is a sign, it's a sign for your blood pressure that your body is experiencing some issues with the amount of fluid that's rushing through it, that being blood. So again, blood pressure disturbances have those, that swelling, that edematous, or also known as kinkles. If you're really looking into, and if you want to find out more information on issues when it comes to why you should wear compression socks and why you shouldn't wear heels during your pregnancy, I did an entire podcast on it. It's episode 66, Can I Wear High Heels During Pregnancy? But it really talks about all of the potential complications of having different vascular disturbances in your lower appendages. All right. So besides having the swelling around the face, the hands, and legs, sometimes you may experience confusion and apprehension. Actually, that feeling like, oh man, I forgot. Now, baby brain is for real. And a lot of dads always ask me, are you just saying that because my wife keeps forgetting? No, we have actually proven brain science, the science back that proves that our brain actually changes. Baby brain or pregnancy brain is real, believe it or not. And not only that, but it doesn't go back to normal until the baby is 2 years old. So if you want to find out more information about baby brain or any of those other things, I did an entire podcast on it. It really, truly was a very interesting, it's probably one of my favorite podcasts that I've ever done. It's episode 32, Pregnancy Brain. So go listen to it and you will actually see, and I'll talk about the studies of the different MRIs that they've done on pregnant women and how the brain structure has actually changed. And yes, forgetfulness is something that happens. Tell your baby I said thank you. All right, signs of preeclampsia. It is not difficult to detect the signs of preeclampsia. Why? We throw on a blood pressure cuff, and if your blood pressure is above 140 over 80 millimeters of mercury, that's mmHg, just in case you're wondering what that unit is at the very end. Other significant signs of preeclampsia include generalized edema that we talked about, tenderness over the right upper region of your abdomen, suggesting a tender liver/spleen. Also, preeclampsia leads to the effects of your baby's growth, leading to small fundal height for gestation. And your physician may also detect signs of visual disturbances while examining your eyes. And these are called arteriovenous nicking. Okay, that's actually, so when you have these dilated, your vessels in your eyes, we can actually tell, man, you're getting high pressure, high flow all over your body. And last but certainly not least, so why does preeclampsia happen? So preeclampsia happens when the blood vessels that supply the placenta, which is an organ that facilitates oxygen and nutrients exchange between you and your baby. The remnants is the belly button, right? It's like what we cut off. You have your cord of how you are actually attached to the baby. Well, that attachment is the placenta. And the placenta is what you feed the baby with, and you oxygenate the baby as well. So when this happens, when the blood supply to the placenta experiences a vasospasm and fails to dilate maximally. When this occurs, the placenta fails to receive an adequate amount of blood supply, leading to harmful molecules that further damage the blood vessels and multiple different body organs. If left untreated, preeclampsia can lead to a life-threatening complication to both the mother and the fetus, like liver injury, acute kidney failure, separation of the placenta, transient blindness. Remember, we were talking about the arteriovenous nicking that we can see in the eyes when you have high blood pressure during pregnancy, and also cardiovascular problems, premature and preterm labor. Do not risk it, ladies. Go get your blood pressure checked. They're usually all over in all of the different pharmacies. So there really is no reason. I really suggest and or recommend that while you're pregnant, while you're shopping, grocery shopping, throw your arm inside one of those little cuffs. Make sure, especially when you hit that 20-week mark, because a lot of things can change, and you also will have your anatomy scan of the baby at 20 weeks gestational age when you go into your OBGYN. That's a perfect time to really discuss blood pressure if you've been having the severe headaches and the weird visual disturbances. All right, now that was really intense. Let's get to some funny pregnancy stories because I think we need it right about now.
On Tuesday? One puke story.
I'll start off with a personal story. I call it the double P. Puke and poop. That's it. Contracting the rotavirus during my first pregnancy, I started feeling an upset stomach after eating questionable picnic food that had been sitting out and holding all those like snotty-nosed children from my husband's side of the family. So it came on me like a ton of bricks once we got home. I asked him to pick me up some Pepto-Bismol, so he left to go to the store. Then I started puking uncontrollably. Ladies, it's disgusting. It is the worst. Do not catch a rotavirus. Before I was able to get up off the ground, the forceful expulsion from the bottom started. You know what that means. While, of course, I was dry heaving. So my husband came home to a double puddle. He started gagging. Second, he smelled the double P smell. And if you ask my husband what he thinks of the rotavirus, he will say lemon Lysol. And now we can't use that cleaning solution because it reminds us of the nightmares we had when pregnant with our first. 6 months pregnant, driving separately to a restaurant to get lunch with Hubs. One cough and then vomit everywhere. On the dashboard, on the steering wheel, on my shirt, in the vents, in the cup holder, and in my lap. I was able to find a plastic bag after my third heaving, but by the time it was all done, we got to the restaurant and my husband pulls up next to me as I'm hysterically crying. Lucky I had a change of clothes with me, so I put my puke clothes into an empty puke bag and then began the 2-hour process of cleaning the inside of my car. That is true love. He really stuck by me as we cleaned the puke out of my vents. Thank you so much, Colleen, for that hilarious puke story. Man, I would have just gone to one of those detail places, honestly. This happened during the early stages of my pregnancy last year. I got weird cravings, and it just so happened that I craved a burrito and cherry limeade that day. My fiance was in the living room playing The Last of Us, and I was watching it when I started to feel sick, putting it off for as long as I possibly could because I knew that it was going to be disgusting. But soon I ended up throwing up chunks of cherry limeade stained bean burrito, and since it was made of flour tortilla, which kind of gets sticky when wet, I also experienced the added bonus of chunks getting stuck in my throat, causing me to gag for a while. Puke tastes disgusting coming up no matter what you've eaten or have drinking, but this was possibly the worst flavor of puke that I've ever personally experienced. The next day, I felt like I got a serious ab workout, and I also had small busted blood vessels around my eyes. To this day, I associate The Last of Us with many wonderful toilet trips. Do you have a hilarious puke story that you just can't wait to share? Send it to me, Pukeology, Pukeology, @nomonausea.com, or tweet me at Pukeology so we can all have a good laugh.
Tips and tricks to stop the up-chuckle that you need.
So diagnosing preeclampsia, when the symptoms and signs of preeclampsia are suspected, your healthcare provider, your physician, your doctor will request various tests to aid in the diagnosis. So some of these tests that may be performed include complete blood count, which may show anemia or reduction of platelet count. Urinalysis, that means peeing in a cup, may reveal proteins in your urine. Liver function tests to check for elevated liver enzymes. Let's say that again. Liver function test to test for elevated liver enzymes, and obstetric ultrasound, which just means taking a look at the baby through ultrasound to check the well-being of your baby and to see how the baby is growing, to make sure that there are no small or irregularities. Can't talk today, clearly. Preeclampsia treatments. The aim of treating preeclampsia is to lower blood pressure and to reduce complications of preeclampsia. You don't want to get to eclampsia. You don't want to seize, ladies. It's just super dangerous. Your doctor may recommend that you have bed rest in a lateral position to increase the blood flow between you, your uterus, and the placenta. While the definitive treatment of preeclampsia is giving birth, remember, who causes everything? That baby. But man, they're so cute. And most of us will end up doing it again, even if we have preeclampsia. But again, while the definitive treatment of preeclampsia is to give birth, it may not be of benefit, particularly when your baby is born too much preterm. We consider a full-term birth at 36 weeks. Therefore, your healthcare may prescribe blood pressure medications to help buy you some time until your baby can survive out of the womb. If your baby is preterm and you're seeing that we are creeping up to this severe problems like getting close to seizure activity, your OBGYN might actually put the baby on some medications for their lungs in order to help develop them. Okay, yes, they are steroids, and it's to help the baby really develop lungs faster than they normally would so that they can survive outside of the womb, because the baby is really what's causing the mother to have massive health issues at that point in time. Also, your doctor may prescribe anticoagulants and anti-seizure medication to help prevent the complications of preeclampsia. So remember, we never want to have any clots or anything like that between the placenta, because the baby needs to be able to eat. Think of it like this. The baby needs to be able to breathe, eat, and drink, and that all happens because of the mom. So tips on how you can prevent preeclampsia. While the exact cause of preeclampsia is unknown, there are a few things that you can do to decrease or reduce your chances of developing preeclampsia, even if you are one of those people who had one of those potential conditions or complications mentioned in the last section. So these items that you can do to help reduce your chances of developing preeclampsia include leading a healthy lifestyle and eating a healthy diet. Planning to get pregnant when you are most fertile, so between the ages of 20 and 35. Attending your antenatal visits early in your pregnancy, or also known as your prenatal visits, and during the rest of your pregnancy to monitor your blood pressure. Most people always ask me, so what are some natural ways to help with high blood pressure during pregnancy? Number one, consume adequate amounts of salt and electrolytes, because contrary to the old belief that salt increases blood pressure is not correct when it's used in moderation. Some of you ladies may have actually experienced cramping, like massive amounts of cramping in your feet, your toes. That's actually because of the fact that your electrolytes are completely off balance, and you may need a little bit more potassium, not just sodium, inside of your diet. Okay. And if you're looking at finding out more information about all types of pregnancy cramps and why you're cramping, why you're having muscle cramps, go check out my podcast, episode 36 of Pregnancy Pukeology Podcast, called Pregnancy Cramps. I know, I'm not very, savvy with naming everything. Everything is just exactly what it is. And if you want to know more about pregnancy cramps, you will take a listen to episode 36. Number two, eat a low carb, low glycemic diet, which means less carbs and sugar, because it reduces the risk of increasing blood pressure. So you're going to want to limit all the good things in life, right? Limit the amount of white flour. Those things include pasta, pancakes, crackers, breads, sugars, sweet drinks. Those are what we call refined carbs. They're not really good for you and your blood pressure, especially when you're pregnant. So just try to kick them out. And instead, tip number 3, consume adequate amounts of protein, especially glycine-rich protein. And I'm going to spell glycine, Glycine. Okay. Glycine sources of protein because it actually helps you maintain a normal blood pressure. So glycine is an amino acid, and it aids in the production of elastin, which is a protein that allows your vessels to expand and contract. In high blood pressure, they are super contracted. They're shrunk down. Okay. Hence why high blood pressure sends blood rushing back up to the heart. And again, rushing back up to your head, that's the headache, There you go. Now you're putting all the clinical pictures all together. So what you want to do is eat glycine-rich amino acids, like foods like bone broth, okay? Bone broth soup is actually really, really, really good for you. Slow-cooked meats. Your crock pot is your best friend for roasts and stews. Chicken with the skin on it. Okay, I'm going to emphasize the skin. And then collagen or gelatin powder. Yes, from Jell-O. You have my permission to go have Jell-O. Don't go too crazy because a lot of times it does have a high sugar content as well, but you're getting the gelatin powder or just collagen. There's a lot of really great companies that are out there. Number 4, consider supplementing with magnesium. Okay, about 48%, that's almost half of Americans don't get enough magnesium in their diets, leading to problems with sleep. So besides eating high magnesium rich foods like green leafy vegetables, pumpkin seeds, sunflower seeds, almonds, cashews, chia seeds, avocados, and green herbs, you can also bathe in Epsom salt. So Epsom salt is actually magnesium sulfate. And guess what the largest organ is? Your skin. So you are absorbing some when you take an Epsom salt bath. That's the reason why when people get very injured, they say for you to actually bathe in Epsom salt because it will also help to reduce the inflammation. If you're still struggling to sleep, you can always try No More Sleepless Nights bands. They're a doctor-formulated natural way to go off to sleep faster and stay asleep longer by applying pressure on your sleep point while the aromatherapy of medically sourced lavender soothes and calms the body to help produce more melatonin naturally. It's a great way to get kids to sleep too. So make sure that you are eating enough choline. So this is tip number 5. So choline, CHOLINE, about 930 milligrams is recommended in your second and third trimester. So eat up those egg yolks for breakfast. Plus, choline is an actual anti-inflammatory. And what pregnant mama doesn't want less swollen feet? I can't name one, right? So again, choline is something, it is found inside of egg yolks. So you can really benefit from it. Try to make eggs a staple for breakfast. Now you know the science behind what is preeclampsia. Severe high blood pressure, what causes it, the baby, but also whether or not you are at risk and whether or not you have been diagnosed, what can you do to help to lower your blood pressure while and during your pregnancy? I hope I've given you all of the information necessary about pregnancy-induced high blood pressure that there is with all medically backed, sound, solid, natural remedies. And if you guys loved this podcast, okay, please let me know. Give me 5-star ratings, hearts for likes, but don't forget to download this episode. More importantly, share it with all your Prego friends. Thanks again for listening to Pregnancy Pukeology Podcast, episode 70. Yes, we are the big 7-0. What is preeclampsia? See you ladies next time.
Pukeology Podcast. Edutainment at its finest.